Learning outcomes should actually improve without the added stress of NAPLAN tests in 2020. That's according to school testing and educational neuroscience expert, Professor Ken Purnell of CQUniversity, who joins me today. Thanks, Ken.
Good morning, Jess.
Before we get started, for those listeners and viewers who aren't already across this topic, can you please explain what NAPLAN is and how it works?
Great. NAPLAN's a test that students do in literacy and numeracy in schools, and it's in state schools it's compulsory throughout Australia, and other schools elect, and many of them elect to do it. So the vast majority of Australian students in years 3, 5, 7 and 9 do the NAPLAN test each year. And it provides information about the literacy and numeracy abilities of individuals and groups like your class, the school and so on, which is a very good thing. So where students need support, then we're able to offer that. And that was the original idea. The big problem in that, though, is that it became an accountability tool. So it had the twin issues, if you like, of yes, we want to identify those students and support them through this test and say, you know, this group of students needs help. But no, unfortunately, principals and teachers became very accountable to the extent that you could lose your job as a principal almost in some places if your results weren't so good. So as a principal, they began to do some gaming things like ensuring that the low performing students weren't there to do the test, the very ones that we were trying to identify for the original purposes. And that's why NAPLAN gets criticised a fair bit, because of that dual accountability where it should stay realistically with its original goal rather than an accountability measure.
Okay, well, just on that topic then, do you believe that NAPLAN testing is needed, is a requirement, given the criticism that currently surrounds it? So, you know, there's everything from the testing is too narrow to NAPLAN actually harms students, given the level of anxiety and stress that's actually put on them.
Well, the current way that NAPLAN's done has evolved as a historic artefact. And I think as a result of our current crisis with the pandemic and so forth, it means that people will be looking at things differently. But before this, the folks who look after this for Australia actually were looking at making NAPLAN adaptive. So let's say, Jess, that you're brilliant at maths and I'm not. What happens is we're both in year 9, and as you go through the test, it keeps on stretching you and making it harder. But it doesn't give me, who's not so good at numeracy, questions I go, oh, I can't do this. It adapts to both of us. So your brilliance can be shown. And also I feel good that I haven't had the sort of questions you have where I would have just walked out going, I'm hopeless. So yeah, it's important that it is adaptive, and we're going to do that. I think the key thing we really want is information on students' literacy and numeracy like is intended, with some form of testing, maybe not nationwide, but giving teachers real-time results, because often the delay between the kids sitting the test and getting results is a few months, and teachers become disinterested in using those results in some cases. In other cases, they find it exceptionally valuable. So yeah, right now it's not performing in the modern era in the way that it ought, but there were plans to fix it with adaptive testing, which is great. But the biggest problem of all is stress.
Okay.
And from top neuroscientists in the world, like Dr. Judy Willis, who is a neurosurgeon and all the rest of it, and a teacher, because folks used to come in with their kids to her clinic, and as a neurologist, they'd say there's something wrong with my child, and she'd do the scans and do other behavioural things and so on and so forth, the different tests, and say, no, there's not. There's something wrong out in school land. And she then became a teacher because she said, I don't want to be sitting in my armchair talking about this, so I'll go for. And she's now one of the world's leading neuroeducation people, but she has that medical background, and it's absolutely fantastic, and the teaching background. And one of the lovely statements she makes that I find so profoundly true in neuroscience is stress is the enemy of learning. Dysfunctional stress. So yeah, unfortunately, when you do test preparation throughout, you know, much of or the first half of year 9 almost, and year 7 and year 5 and year 3, as if they didn't get it the first time back in year 3, but you know, got to repeat it every couple of years. Do this sort of stuff, unfortunately, it increases the anxiety, and it takes up an awful lot of teaching time. So the poor kids are getting very anxious, and we've got enough mental health issues in Australia, as we already know, with 1 in 5 of our students displaying some form of mental health issue. And in fact, at senior by year 12, it's almost 1 in 2. So
Wow.
let's back it off.
Okay. No, that's very interesting. Now, given that NAPLAN testing has been cancelled for 2020, what are some of the positives that have come of this in terms of students, teachers, and even markers?
I think one of the big things with this pandemic now is that we're all concentrating more on our physical and mental health. And I think there will be both improvements for students, obviously not making themselves vulnerable potentially. And of course, the invigilation of those tests means that you've often got older Australians and so on involved as teachers or whatever. And so it does away with that, which is good. But also that time where people are able to sit back and think, how can we do this better? Because one of the big things out of this time right now is that we're going to have lots of opportunities to do things differently. And for example, much of our schooling model, again, I'm talking to top neuroscientists, and I said, but you say our schools are fear-based, afraid, scary sort of places, as opposed to approach-based. So I'm curious, I want to learn about this. So the answer from that person was, unfortunately, Australian schools and many others around the world are very much fear-based, not approach-based and that sort of thing. So as we move into this new environment, I think we'll be able to move away from the almost 18th century, 19th century model of education with kids sitting in rows and doing that from an early age, and this sort of stuff we know is not particularly good, especially early childhood educators know that well. And I think we'll see that the online opportunities that are provided, because a lot of schools are going to be moving their learning platforms and so forth from the typical industrial age classroom to an online environment. And if you just replicate what you did in the classroom, no good. One of the things I think, Jess, will be a big advantage of this is that one of the greatest PD cries of teachers is, give me behaviour management stuff. I have problems with students. And so because almost that behaviour management issue drops off, you're going to have more time for teachers to actually spend on thinking about how can I create really great learning experiences that are brain friendly for my students, powerful and effective, rather than worrying about what am I going to do with John and Mary again today.
Yeah. Okay. And some of the innovations that we are currently seeing in the particularly primary and secondary school sectors, do you think that these will continue post-pandemic and may even be built upon moving into the future?
Yeah, I think it will be, just because you got a situation. I received an email overnight from the top body in geographical education in the world, from the International Geographical Union. And with that, they were saying, colleagues, what are you doing? Because we've put a lot of our stuff online. How are you helping the students to, for example, get a better education that can prepare them for such things as this critical, emotional, unstable time? This sort of unprecedented disruption to learning and all the rest of it that could potentially happen. And our teachers are facing up to that straight away and doing some brilliant things, so that, as the Prime Minister says, we're trying to ensure that education goes on not quite seamlessly, but quite fluently and quite well. And as a result of that, yes, we've had to, at this very short notice, involve parents and carers and others to assist. But what we want out of this too with the actual children is better ways of being able to provide learning experiences and to help them to develop that resolve and the commitment to experiencing things, if you like, where they're able to evidence better resilience, able to adapt better, and to collaborate with others and be very empathetic with others. So I think this moves us away from some of those issues that we were commonly seeing in schools, potentially, to an entirely new world, to an entirely new ball game, potentially. I don't see us returning, as they're saying, for example, with office spaces in the central business district, working from home, a number of businesses are finding very successful, and you don't have to have the face-to-face. We have to have the face-to-face. That's obviously critical. But I think we'll find that prices of CBD offices might drop initially, and those that have to look after those will worry about what to do there.
Yeah,
To make it effective. But I think we'd have experienced the same in education. What was once a way of doing business is a little bit, but we can focus a lot more on really quality achievement by students and improving their wellness, far more so than we've done in the past.
Okay, so there's a lot of benefits that are going to come out of this tough time that we're currently facing by the sounds of it. What are some of the innovations in particular that you've come across, during this pandemic that have really stood out for you?
Well, one of the fun ones is one of my good colleagues has been at a school in Brisbane for many years, and it's got over 2,000 students, a big one. And anyway, I was having a look at their resources because they've been online for a bit and they do a lot of stuff like that, and it's pretty smick. And of course, I've been involved in distance education since 3 decades or whatever, and reasonable at it. And I went, wow, isn't that great? And one of the things we're doing at the university is, of course, making ours better and better all the time, naturally. And I'm doing stuff in a new platform that we have, Be Different, and that's kind of cool. But I went, gee, if other schools could do as well as this, and it really is focused on the learner and their learning and adapting to them. So again, Jess is really cool at maths, and the maths that she does is suited to her. And, we're both again in year 9, and I get stuff suited to me, and I don't have to wait 2 weeks to get my test results back or my, formative assessment back. Pretty instantaneous. And not only that, I'm not embarrassed that you show me up yet again.
I'm sure that wouldn't actually happen, but yeah, no, that's all good. Well, and is there any other innovations that come to mind other than that particular one?
As I said, adaptive testing, the online presence of quality, the drop away in the need for behaviour management, arguably, and particularly the focus on teachers of using their professional substantive knowledge and skills to really craft and hone those further in maximising student learning and their wellness. And one of the bits that's been missing, one of the reasons why we have such high rates of youth issues and so forth in Australia with suicide and other things, is that inability to address that wellness side. And I think that's going to come through very strongly because people right now are learning new beliefs, new values. I actually just went to the supermarket and nobody came within about 2 meters of me. It was kind of cool. I went, oh, I'm good. So those sorts of things, even seeing friends wave at a distance or whatever, talk to them on the phone or in other ways, but connection. Because one of the things, Jess, I must say, is that whilst we may be physically distant as a student working from home or whatever, we absolutely need the social connection because our human brains are designed for social interaction. And so, you need to ensure that's maintained.
Enjoying this episode? Subscribe to CQUniversity Commentary on Apple, Spotify, or wherever you get your podcasts for more. And remember to rate, review, and share.
In a way, even though we are socially distancing and, most of us are in isolation, we are learning to reconnect.
I think that's a good thing because, for example, I happen to belong to a men's group that's just formed. There's 6 of us, and they call it a Connect group, and you get to phone one another, and then for an hour and a half on Wednesday nights, we're on a Zoom session. And so talking about whatever stuff is, and the casual social chat on the phone, and just checking up with one another. How you doing? How's whatever it is. And I think that attention to really valuing other people more and respecting them more will help a whole bunch of ways, because once you stop those neural firings in the brain that say it's okay to, for example, for some men, unfortunately, and some women, domestic violence and things like that, once you calm that sort of stuff down and you have other things firing up, helpful habits, what will happen is those bad ones will tend to fade away. And I think this moment in time, this moment in history is helping us to decide, well, what do we value? And yes, unfortunately, we're coming on the heels of a lot of difficult things, for example, in domestic violence, and thus they're predicting, of course, that to escalate initially. But I see long term, if we can get people to change their values that little bit and to actually say, that's not helpful thinking. I've got to do this, that, and the other. Whether I'm a student who's angry or whatever, that's not going to help me learn. It's going to just shut down my ability to get the blood flow, the neural firing in the prefrontal cortex where I need it. It's going to take, I often talk about the green bit at the front of the head. That's where you want the activity, if you like, the blood flow, neural firing, neurochemistry sort of stuff going well for you, the neurobiology. The limbic area, which is vaguely called the orange, like the stoplights, and then the brainstem, the red bit. Unfortunately, we're seeing a number of people right now, because they're frustrated, they're terribly anxious, hitting the orange bits pretty often. But as they learn to become more resilient, like the kids, I think find that we get a much better approach to, I can be kind and respectful to others, and they can be kind and respectful to me. So I see an initial problem, if you like, that we're hearing about in the media, both social and mainstream, changing, I hope.
Okay. Yeah. Well, fingers crossed. No, that sounds really good, and it's quite refreshing too to hear, you know, of the positives that are coming out of this situation in particular. Now, in the shake-up, as you may call it, to the school term, where parents are now coming on board to help teach children from home, do you think this will have a lasting impact on kids in terms of the education that they're receiving? Could this potentially put them behind in their school year?
A three-letter word, yes.
Okay.
Because a number of parents don't feel skilled, and they say teachers should be paid more money. We're hearing all that sort of stuff. Please take them back as quick as you can. It's not a matter of advanced babysitting. It's a matter of, I actually can't do that year 10 novel thing that my boy has to do, or that year 12 maths that my girl has to do, or whatever. And so for a number of folks, they suddenly had thrust upon them stuff, you know, who is the prime educator of their children? The parent carer. Schools and that teachers support them in that, but they have specific things they're doing, curriculum and all the rest of it, that's been very well designed over quite a few years. You know, we've got the Australian curriculum basically all the way through these days, and assessments associated with that are really of high quality. Yeah, you can criticise it a bit, but are very good indeed. And so parents aren't equipped to do that. It's a bit like saying, well, I think I'll fly a plane, and you know, until I develop the appropriate skills, probably not a good idea to fly with me, Jess.
Yeah. I will definitely not be getting on board.
I would.
Okay, but I guess in this trying situation, though, they are doing the best that they can, and you know, schools are definitely helping the cause in making online resources and other educational materials available to parents, I guess, to help them feel more confident in assisting. And you know, it may be for a short term, it may be for a long term, but at least there's some support there for them.
Well, to give you an idea, in Queensland, for example, we've got the Curriculum Authority, the Queensland Curriculum Assessment Authority, and, for example, Education Queensland, that have a lot of resources there already that pick up almost off the shelf. Not quite true, but like that. In fact, the Department of Education Queensland has so refined their materials, they drill down to a lesson, their curriculum to classroom sort of stuff that's around. And again, one can be critical of that, but it also is of use, particularly if you're a parent, to be able to sort of get things off the shelf. But once we get past this and we go back to situations where professionally trained and very experienced teachers rather than novices, because you know, if you've got children yourself, folks, you know what it's like to deal with your 1 or 2 or 3 or whatever number of children you got. It's very different when you're dealing with 25 and 6 different classes across the day and whatever else in different subject areas. So it's a lot more intense than the snapshot you get with your limited exposure. But could I make this one point I think is important? You know how doctors currently, a number of them are doing tele-doctor stuff, for want of better descriptions, where effectively, if you need a script or some sort of attention for a diagnosis and then a prognosis of what to do and all the rest of it, what's happening is they're able to do that online. They wouldn't do that before, and for very good reason. you'll be able to have the diagnosis done and say, well, you need this antibiotic for that, or you need that ointment, or whatever it is. And the script is automatically going through to your pharmacist, so you don't have to go into the surgery and get it all signed, and it goes through to your pharmacy straight away. And they drop it off at your front door. So I actually haven't walked away from my computer. Well, hopefully I have, because you should get up every half hour, you know, body, but that's another story on neuroscience. Exercise is critical, as we keep on hearing in the things right now. But just that note, tell the doctor, will teaching be a little more along that line? Will in the future nurses play a stronger role, and pharmacists and so forth in the medical health system to support the sorts of things that perhaps doctors may not necessarily be needed in, and other things they can focus on? So that notion of tell the doctor your medication arrives at the door without having left your home, I don't think we need to get in education quite that, but because of the social connection being absolutely critical and so on, especially as you develop and need those social skills too. But I do think we'll see a blending between teledoctor and what we used to do.
Okay, that's an interesting insight. And do you think the use of, I guess, video conferencing communication tools that children are becoming familiar with now is going to help them in the long run as well? Because, you know, I remember being back in school, this sort of technology was just, you know, even if it existed, it wasn't used in the classroom. So do you think this is sort of preparing them for, you know, tertiary education? Is it preparing them for the workplace really early on?
I think so, because basically you've hit the nail on the head. You know, as a certain types of workers, obviously if I'm driving a tractor, it's not going to work too well, but on a farm. But if I've got an office job or whatever, and I can, you know, use Zoom, whatever materials is, and apparently the Zoom subscriptions have gone through the roof, where people are able to interact at a distance and so forth. Yeah, it's preparing that, as well as the online learning, because a lot of folks find that they're working odd hours, they've got kids to look after, they've got holidays they'd like to go on. And so the traditional ways of the school term, and even, dare I say, the university term, mean the number of folks would like greater flexibility. And I think that's one of the things that will happen, because right now we sort of run our schools at the most inopportune time. For example, adolescents, we know they like to party on late till about 1 a.m. and then get up late. And they need around about, for example, 9.5, 10 hours of sleep from the research. And they actually, according to Australian stats, large numbers of students get about 7.25. So currently they're arriving at school stressed from sleep deprivation and things like that, that I think in this new future, they'll learn that, oh, I've really got to look after myself, go to bed at the same time, get up at the same time, practice sleep hygiene, do a bit of mindfulness, whatever it is that they learn about for their wellness. And I think it will help change, because people are really going to focus in more on their health, much more than they've ever done before. And you can see that happening in the change as you walk out in the street. There's well, not the street, but the shopping place that I went to a moment ago.
Okay, so NAPLAN testing may not be going ahead in 2020, but students are definitely learning new skills during this time.
Yeah, and some are put on hold, unfortunately, and it's a terrible thing if you're a youngster. If you think of it, if your education's put on, let's say you're 5 years old, if your education's put on hold for 6 months, for 12 months, for 18 months, that's getting close to almost half your life has been put on hold from the more formal sorts of things we expect kids to do. And be telling down the track, not sure, obviously, because with our brain plasticity, we can, of course, have that attitude. Yeah, I'm going to learn that and do it quickly and sorts of stuff. But yeah, I hate to say it, but especially for the younger folks, it's a bit of a problem that they're not being exposed to high quality learning experiences in some instances. In others, they're fine. But look, I'm a parent, been a teacher for many years in university and so on. I'm really glad I don't have to homeschool my kids, but some people like it a lot, and that's good on them. But the vast majority of us want to go to work and socialise at work, earn some money, not have to do that particular job. And especially when we feel ill-equipped, and especially when you feel like oh, Dad's telling me this again, I don't believe him, whereas if it was a teacher, oh, that's authoritative. That's good.
Yeah.
I'll listen to that one, not Dad.
Yeah, a completely different story, really, when a teacher is telling you
Yeah.
to do something.
Yeah. That's why we can get away with 25 of them instead of the 2 or 3 to sorry for the joke.
No, that's okay. All is good. Well, thank you very much, Ken, for joining me today to discuss everything NAPLAN testing and beyond. I guess it's an exciting time for the education space at the moment. You know, many may not see it as such, but definitely the benefits will prevail down the track. And yeah, in the meantime, stay safe, and I'll be look forward to chatting to you down the track.
Stay safe, Jess. Thank you.